Let's talk about this idea that cholesterol values, total cholesterol and LDL cholesterol, are good predictors for heart disease, for heart attack in your future. Is that true? No, they're lousy predictors. They hardly tell you anything. In fact, if you look at age is actually a pretty good predictor for heart disease, and it's far superior. It's far more powerful a predictor than any cholesterol value. But how do you use age, right? Do you say if you're 60, you're going to have a heart attack? So it's kind of a useless observation to say that age is one of the most powerful risk factors. Other problems with cholesterol values. Total cholesterol is a measure of all the cholesterol in various fractions of your blood. So it also includes HDL cholesterol, which is a good measure, right? So let's say you have a really low HDL cholesterol of 25 because you're overweight, you eat badly, you get a lot of hydrogenated fats in your diet, you eat a lot of carbs and chips. You change your lifestyle, you lose a bunch of weight, you take fish oil, you exercise, and your HDL goes from 25 to 85, which by the way is very realistic. I've done it many times. That's a rise of 60 milligrams per deciliter in HDL. Well, the HDL is contained within total cholesterol, so it means that the total cholesterol likewise rise by 60 milligrams per deciliter. If it was, let's say, 240, now it's 300. And the doctor says, oh no, you need a statin drug. So the doctor's going to treat the total cholesterol that went up, even though it went up for a good reason, for a good thing, right? A rise in HDL. That's just plain dumb. LDL cholesterol is calculated. I call it fictitious LDL. You'll see this on a cholesterol panel. You'll see it in parentheses, calculated, or CALC. It's calculated from an old equation called the Friedewald calculation from about the 1950s, 1960s. And it was meant to be nothing more than a crude effort to estimate the amount of cholesterol in the low-density lipoprotein fraction, a very specific fraction of blood. But the guy who developed it, Dr. William Friedewald, knew it was crude. And it was based on some very crude assumptions. He assumed that everybody eats the same, which of course is not true. He assumes that everybody has a low triglyceride level of 150 milligrams per deciliter or less, which of course is wildly untrue, particularly in this day and age where people are carb overloaded. And there's some other assumptions built in. But it means that there are many factors that throw that value off, and so it is wildly inaccurate. You know what makes it worse? Limiting or cutting back the carbohydrates in your diet, as we do in my Wheat Belly program, my Undoctored program, as other people do in ketogenic diets, paleo, Atkins, low carb, etc. Well, when you do that, you invalidate the equation. You invalidate the Friedewald calculation for a variety of reasons, but one of the main reasons is when you cut the carbs in your diet, you've stopped having your liver convert carbs to VLDL particles, okay, triglycerides and VLDL particles. And that changes the complete behavior of lipoproteins and it invalidates the Friedewald calculation. It's not uncommon, you may have seen this. People who go very low carb or ketogenic or whatever see a rise in LDL cholesterol. The doctor goes berserk and tries to force statin drugs on you, not realizing that it's a wildly inaccurate number. It wouldn't be uncommon to, if you got a better measure, to find out that the LDL cholesterol of 240 is really more like 150 or 120, something like that. And so do not rely on the calculated, ridiculous LDL cholesterol. It's a lousy predictor to begin with, and two, it becomes even worse when you start to change your diet. Another problem. What exactly does LDL cholesterol tell you anyway? What's the average LDL cholesterol in this country, including infants, children, teenagers, the young adults, older adults? About 133 milligrams per deciliter. What's the average LDL cholesterol of someone who has a heart attack or dies from heart disease? About 133 milligrams per deciliter. So what does that tell you? So if you have an LDL cholesterol of 120, are you safe? Of course not. If you have an LDL cholesterol of 180, are you in danger by next Tuesday with a heart attack? Doesn't tell you. It's wildly inaccurate, does not tell you very much at all. But it's the value they treat with statin drugs and other drugs. So it has become a source of huge amounts of revenue. And that's why this fictitious value that has such poor predictive value continues to be talked about and used and treated by my colleagues. The real tragedy, though, of cholesterol values is not that they're just plain stupid and almost useless. It's that it takes everybody's attention. Your attention your doctor's attention away from the real factors that cause heart disease, that have nothing to do with cholesterol. So your doctor probably doesn't know that he can decipher very precisely your coronary risk, your cardiovascular risk, by doing something called NMR lipoproteins or other forms of lipoprotein testing like gel electrophoresis. And that breaks the particles down in your blood, not the cholesterol in the various fractions, but the actual particles. So one of the measures you get in an NMR lipoprotein analysis is you get the number and size distribution of LDL particles. You get the number and size distribution of VLDL particles. You get the number and size distribution of HDL particles and some other things also. It gives you a fine, deep look into what's going on in your bloodstream. And it tells you what could cause heart disease. The most important measure of all will be the number of small LDL particles, because small LDL particles are kind of different. They're small, they can get into places big LDL particles can't. They're very adherent to the tissues in the artery wall. Once they get in, they're much more prone to provoke an inflammatory response and become embedded into the artery wall. They're also very long-lasting. So if you eat a food, grains or sugars, that provoke formation of small LDL particles, it lasts about 5 to 7 days in your bloodstream, as compared to 24 hours of a large LDL cholesterol particle provoked by fat consumption. So which is worse, fat or carbs? Carbs are far worse from a heart disease viewpoint. So if you have a carbohydrate indulgence, for me that means any net carb intake of more than 15 grams net carbs per meal, you will provoke formation of small LDL particles that last about a week. So one indulgence in carbs per week that goes over that limit means you have 52 weeks of cardiovascular risk. Do you see how powerful that can be? So doing NMR lipoproteins or other forms of lipoprotein testing gives you deep insight into what's going on in your arteries. And it also makes it eminently obvious that heart disease is a dietary issue. It is not a drug issue. It is a dietary issue. And by doing the diets I advocate, where we cut grains and sugars and do some other things, gives you magnificent control to convert a disastrous lipoprotein panel to a wonderful, beautiful, perfect lipoprotein panel. Now, there's other factors you want to look at. Your vitamin D status, your 25-hydroxy vitamin D blood level, that we aim for 60 to 70 nanograms per milliliter, typically achieved with 5,000 to 6,000 units of an oil-based gel cap per day. We look at magnesium, because you're not getting magnesium in your drinking water, so we supplement magnesium, and we try to get our RBC magnesium blood level to the high end of the reference range. We address thyroid, because any measure, even the most marginal degrees of hypothyroidism, really fire up atherosclerotic plaque. I'm talking about even marginal levels. We try to get a TSH of 2.0 microunits or less. When you get into ranges like 3.7, 4.1, which, by the way, your doctor will tell you is normal because it falls in the reference range quoted by the laboratory, even those low levels are sufficient to really cause a growth of atherosclerotic plaque in your coronary arteries. So we address thyroid issues. We start by supplementing iodine that many people are not getting, and then we go further. That's a whole other conversation, but you want to pay a lot of attention to obtain optimal thyroid status. You need to address bowel flora. Bowel flora is proven to be a major factor in cardiovascular risk. It can be dysbiosis, it could be SIBO, small intestinal bacterial overgrowth. SIBO is looking like a major cardiovascular risk factor, and SIBO, I think, is everywhere. I think it's the biggest epidemic, bigger than the epidemics of type 2 diabetes and prediabetes, and on a par with the epidemic of obesity and overweight, which is about 2/3 of Americans. So I'm talking about a wildly out of control process. That's a more complex conversation, so I invite you to see some of the introductory conversations I have in my other videos. But even as useful as all those measures can be, all those strategies and measures can be, do any of them tell you that you might have a heart attack next month, or next year, or 5 years from now, or 10 years? They don't. They just tell you potential causation of coronary atherosclerosis. So how can you put a timeline on it? Well, that's what CT heart scans and coronary artery calcium scores do. These are easy tests to go through. It takes just a few minutes, and they give you a score. 0, no calcium, and increasing amounts of calcium up to thousands. And the higher the score, the more likely it is you're going to have a heart attack or die from heart disease. Such that if you get to a score of about 1,000, there's a risk about maybe 15% or so per year of dying or having a heart attack. Why measure calcium? Well, calcium occupies 20% of total atherosclerotic plaque volume, such that if you measure 2 cubic millimeters of calcium, you've got 10 cubic millimeters of total atherosclerotic plaque. The more plaque you have, the more likely it'll provide the opportunity for plaque rupture, like a little volcano. That's what heart attacks are. People think, oh, but the heart scan score doesn't show blockage. That's not what we're looking for. Blockage is what you look for in somebody with symptoms of chest pain or equivalent. Okay, that's something different. We're looking for the potential for heart attack and how much coronary atherosclerosis you have. So a CT heart scan that gives a coronary artery calcium score is a wonderful test that grades your risk. And it doesn't tell you precisely when you're going to have a heart attack. It doesn't say you're going to have a heart attack on Tuesday, September 27th at 6 p.m. It's not like that. But it gives you much more powerful, much more confident odds. But even better than that, it gives you something to track. So let's say you do have a heart scan. You're a 50-year-old guy or maybe a 57-year-old woman, and let's say your score is 280. Well, if you did nothing, I hope you don't do nothing. If you did nothing, the score is going to go up 25% per year. So maybe 400, right? Go on, do the math. And with every rise, you're closer and closer to a heart attack or dying from heart disease. What if you take a statin drug at high dose, aspirin, maybe a beta blocker, and a low-fat diet and exercise program? What my colleagues call optimal medical therapy, the best they have. How fast will your heart scan score go up? 25% per year. It has no impact at all on this measure. So what do? Follow the program I just told you about, right? The diet, where we eliminate all foods that provoke small LDL particles. We address those nutrients I talked about that all address insulin resistance. That's very prevalent. And you rebuild a healthy microbiome. That's what gets you control over your coronary, over your heart scan score. And most people stop increasing their score. Many actually reduce their score. So it's very powerful, and it gives you an index of risk, and then it gives you something to track so you know if your program is successful or not. That, I think, is a far more rational, far more satisfying, far more effective way than just blindly throwing cholesterol drugs at you for this ridiculous measure called cholesterol. Now, if these kinds of conversations interest you, I invite you to subscribe to my YouTube channel below, of course. I invite you to join my conversations on my Wheat Belly blog, Undoctored blog. The Facebook page is associated with those books and conversations. Of course, my Wheat Belly books, my Undoctored books. If you want the most recent version of these programs, I recently re-released my Wheat Belly book in the revised expanded edition, where I took all the new lessons we've learned over the years and compressed them into one book, along with newest strategies, newest thinking, more recipes, new success stories. So take a look at that if you want to get this program down right.